Hi, I'm Tony Guerra. I teach college pharmacology, and I created the free Pharmacology course podcast to help you recognize, understand, and memorize pharmacology and drug names on the go. This first 7-lecture series provides a basic understanding of how to recognize common drug names, understand the basic classifications, and quickly memorize them for exams. The print, ebook, and audiobooks these lectures are based on, Memorizing Pharmacology, a relaxed approach, can be found in the show notes taking you to audible.com. If you've never had a book from Audible, you may be able to get the 7-hour professionally narrated version for free. Please do take the time to subscribe, rate, and review these episodes. It helps other people find out about them. Welcome to Episode 2, Musculoskeletal Pharmacology.
This is Chapter 2. We'll do musculoskeletal system. And the first thing that we're going to talk about are the first group of drugs. And all of this that I'm going to put up there is all in my head, so I'm just going to do this from memory. But you might learn it piece by piece, and I'm going to show you the pieces and how they group together, and then within those groups we'll have 3 larger groups so that you can learn this column, then hopefully next column, then next column. So the first column I'm going to talk about are the OTC NSAIDs, the non-steroidal anti-inflammatory drugs. And there are 3 of those. Start with aspirin, ibuprofen, which has 2 brand names, Advil and Motrin, and then naproxen. Okay. So the first thing we want to do is make sure that we check for any stems, and a stem is something that indicates what drug class it's in. Profen is a non-steroidal anti-inflammatory stem. Proxen isn't. It looks very similar though, so if you're trying to memorize it, that's one good way to do it. So we go from the OTC NSAIDs, aspirin, ibuprofen, naproxen, to what would be a non-narcotic analgesic, also over the counter. Okay. And the one that you're probably most familiar with is acetaminophen. Tylenol. Okay. There's no stem here, but what you can see, just like with the aspirin, aspirin is actually acetylsalicylic acid, which is abbreviated ASA. We also have an abbreviation that actually comes from acetaminophen, which is from N-acetyl-para-aminophenol, which is APAP. Okay. And we'll use that in just a minute. So then we've got those. And these take care of most things, most analgesia, most pains over the counter, but maybe you have some kind of a migraine or something like that. Okay. So we're going to combine them. Okay. And we'll combine the OTC NSAID plus non-narcotic in a medication called Excedrin migraine. It includes aspirin, ASA, Tylenol, APAP, and also caffeine. And the caffeine is a vasoconstrictor. It helps narrow the blood vessels in the brain so that there's less pain. Okay. So we started with the OTCs, and the natural movement or progression is from OTC to RX. So let's go to the RX NSAID. Okay. And the first one we'll look at is meloxicam. Okay. And this also has a stem, ICAM. Okay. And that's Mobic. Okay. Okay. And then we also have another RX NSAID that's a COX-2 inhibitor. That one's going to be Celebrex or celecoxib. And that's Celebrex. Okay, so the first kind of panel, first group of drugs that we want to look at are these 7. And we see that we have non-steroidals, a non-narcotic. We're going to combine the two to help memorize these 2 groups. Then we're going to have prescription NSAID that works just like ibuprofen and naproxen, the meloxicam. And then we have this COX-2 inhibitor, which is supposed to protect the stomach. Okay, so again, in order, aspirin, ibuprofen, naproxen, acetaminophen, aspirin, acetaminophen, caffeine, meloxicam, and celecoxib. Okay? So that's the first group, and that's how we would do that. Within the groups, though, make sure that you want to try to alphabetize it. So A comes before I, before N, and I'll show you where I'll break that rule a little bit here. Okay. Okay, so the next group we're going to look at are the opioids and narcotic antagonists. Okay. And we'll start with the Schedule 2. So again, the DEA schedules. 1 is one that has no medical value. 2 is the most addicting. 3 is less addicting than that. 4 is less addicting than that. And 5, and so forth. So we'll go over a 2, a 3, and a 4. So the first one is morphine. Okay. MS Contin. Okay. Then fentanyl has a couple brand names. Okay. One is Duragesic. Okay, so an analgesic that lasts for a long duration. And Sublimase, although it's not sub-Q, you can think of it going intramuscularly. Then we have hydrocodone with acetaminophen. That's Vicodin. And then oxycodone with acetaminophen. And that's Percocet. That's an R. Okay. All right. So we've got 4 C2 opioids, and you'll notice that I've got it alphabetically here, but not here. Why? Well, morphine was the first drug. It's a prototypical drug. If you have something like that, you want to take it and put it at the top, and then you'll alphabetize the ones that come after it. Okay? But now we're going to go in DEA order from C2 to narcotic C3. Okay. And the C3 is going to be Tylenol with codeine, but we call it acetaminophen with codeine. And one of them is Tylenol number 3. Then we have a narcotic, C4. It's a mixed opioid, so I'll just call it a mixed opioid, but it is Schedule 4. And that's tramadol. Okay. And we'll just underline ADOL, and that's the stem there. Okay. So we're over here. We used the NSAIDs, and we did them from OTC to RX. Over here, what we're going to do is we're going to use the numbered DEA schedules from 2 to 3 to 4 to help memorize them. And then we've got a narcotic antagonist. And it's nice to have usually the agonist before the antagonist. It just makes sense intuitively. And that's naloxone. Or Narcan. And the stem there is the NAL, now. Okay. So These are the opioids, and how you remember them, use them in DEA schedule order. Agonist first, antagonist next. Okay. Next we're going to go actually in the body from head to toe. And the first group that we're going to have, it's easier to probably put them up here. Okay. Are the triptans. And the triptans are going to be the migraine medications. Okay. Elatriptan, Relpax, and you can think of relief, and pax means peace in Latin. And then sumatriptan, which is Imitrex. Okay. There's an IM version, so you can think of the IM and Imitrex. But really it's these triptan stems that tell you what kind of medication you have. Then from there we're going to go to what are called the DMARDs. And DMARDs are disease-modifying anti-rheumatic drugs. And I'll show you why I'm going to put this not in alphabetical order. So, methotrexate, it's Rheumatrex, because it's for rheumatoid arthritis. And methotrexate has the trexate stem. Okay. And this is a non-biologic. Then we have two biologics, abatacept and etanercept. So Orencia and Enbrel. Okay. And I'm going to underline the sept, because that's the stem for these biologics, but also the TA. So we'll double underline the sept and the ner. And so the TSEPT and NERSEPT means that it's a certain kind of disease-modifying anti-rheumatic drug. But you see we don't have alphabetical order here because we have a non-biologic, then we have two biologics in alphabetical order. Okay. So after the DMARDs come something for, so the way I remember it is we start with the head, then we go to the joint, and then from the joint we're going to go to the bone. So we have two bisphosphonates. Alendronate, ibandronate, Fosamax. Students like to think of fossil. Boniva has the word bone in it. Okay, to remember those. Okay. And these aren't for osteoarthritis like the NSAIDs would be. These are for osteoporosis, so some degradation of the bone. From there we have the muscle relax, and then the dronate stem. That tells you that these are bisphosphonates. Then we have the muscle relaxers. Okay. And the muscle relaxers include cyclobenzaprine, which is Flexeril, and diazepam, which is Valium. Okay. And the azepam is a stem. So cyclobenzaprine, you can see the word B-E-N-Z, and it's like you're bending, and then flex for Flexeril. Diazepam, it's a benzodiazepine. We'll see benzodiazepines in the neuro section, but these are also used for muscle relaxation, so I put one here. We actually have one more set of drugs, but I want you to notice where we've gone. We started with the head, so triptans for headache. Then we went into the joint, and then from the joint we went to the bone, and then out to the muscle, so you're thinking inside out. And I'll put it over here. Anti-gout. Okay. So I'm going to have two anti-gout medications, allopurinol, which is Xyloprim, and febuxostat, which is Uloric. Okay. And the Zostat is the stem. Now, these anti-gout medications are for chronic gout. So what we're doing is we're preventing uric acid from forming. And you can kind of see the uric from uric acid in here. And then the LO for lower, so U lower uric acid. Both of these prevent the having too much uric acid. If you have less uric acid, you'll have less gout. But again, alphabetize them within the group. And here we are, gout 50% of the time is in the toe, so a good place to memorize them. Okay. So those are the 25 musculoskeletal drugs in a nutshell.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes and Amazon.com, in print, ebook and audiobook.